So hey guys, what's up? So welcome to World News 20 News channel. So let's talk about WHO's underfunding hits global disease response. Do most public health plans stem from large crises? It is definitely true that many of the world's most significant and successful universal health coverage reforms have followed and been a consequence of major crises. Good examples include the UK, France, and Japan after World War II, Thailand after the Asian financial crisis, China after the 2002 SARS crisis, and even Rwanda after the 1994 genocide. To what extent does the underfunding of bodies like the World Health Organization impact global information sharing on disease? This crisis has once again put the spotlight on the underfunding of the global health bodies like the WHO, which is limiting their ability to coordinate the global response, including the sharing of the information across the national boundaries. In September 2019, the Global Preparedness Monitoring Board report recommended that member states need to agree to an increase in the World Health Organization contributions for the financing of the preparedness and response activities and must sustainably fund the World Health Organization contingency fund for the emergencies, including the establishment of the replenishment scheme using funding from the revised World Bank Pandemic Emergency Financing Facility. Looking to the future, it is vital that governments heed these recommendations and the other ones outlined in the GPMB report. Poor countries do not have the money to make public health a top priority, many governments say. I don't agree with this. The amount that governments spend on public health systems and health in general is a political choice weighed up against the priorities. Some countries choose to spend a higher proportion of their GDP through public health financing than others, and in many instances have increased public spending quite dramatically. China did, for example, after the SARS epidemic in 2002. There are a number of countries that demonstrably give a low priority to public health spending, and regrettably that includes India. Could something good and useful emerge on the other side of this pandemic? Yes, I hope. This terrible tragedy will be a wake-up call that the world collectively needs truly global universal health coverage, whereby everyone on the planet receives the quality health services they need without suffering financial hardship. This clearly means access to and use of public and preventive health services to stop outbreaks becoming epidemics, and also curative, rehabilitative, and palliative care services for those who become sick. This can only be achieved through publicly financing the health system so that the healthy, wealthy subsidize the sick and the poor. And there are already signs of some countries recognizing that they do not need to socialize their health financing systems more. For example, Ireland, Spain, South Africa to tackle this epidemic, and this may also happen in the countries like India and America as well, which have become dominated by the inequitable private financing. So hopefully, in the long run, responding to this epidemic will take the world closer to the SDG goal of universal health coverage. So if you like the channel, so kindly subscribe to it.